like to meet you, stuff like
good.
this. So Sasan is back, and he's got a presentation here on this new healthcare monstrosity. So go ahead, take it away, Sasan.
Yeah, thanks, Jeff. And as Jeff mentioned, what I'm going to talk about tonight is the recent healthcare legislation that passed. Now, some of you may be thinking, well, that's kind of old news. You know, it's already passed. Why are you talking about it now? The reason I'm talking about it is because it's not going away. We're going to have to deal with this bill and the effects of this bill for quite some time. And as you've already probably guessed, most of you know me, I am a libertarian, a pretty hardcore libertarian. So most of you could probably guess that I am against this bill very, very strongly. But I'm not against it necessarily for the reasons you're used to hearing. Now, what I want to start by saying is that what I'm going to talk about tonight is not a moral analysis of the bill. In other words, I'm not going to discuss whether or not it's moral or ethical to force people to buy insurance at the barrel of a gun. I'm not going to talk about that. That's for a separate discussion. Also, I'm not going to do any kind of legal analysis. You know, I'm not going to sit here and pick apart, is it constitutional, is it not constitutional? Again, that's a separate discussion. I'm also not here to defend the status quo. I'm very aware that the current healthcare situation is completely unacceptable. Healthcare is ridiculously expensive, so expensive that you almost have to have health insurance. Although I'm going to talk about ways to fix that that are completely different from what is currently being passed through Congress. What I am going to talk about is an economic analysis of what this healthcare bill means to all of us. In other words, I'm not going to talk about what's in the bill, because very rarely is what's in the bill what's actually going to happen in real life. And the simple fact of the matter is, the reason why that is because governments cannot override the laws of economics, try as they might. You know, it doesn't matter what they write in the bill or what's intended in the bill. What actually happens, the consequences are completely different. You know, just like governments cannot pass laws against the laws of gravity, they cannot pass laws against the laws of economics. You cannot sidestep certain things. So that's what I'm talking about tonight. What will actually happen as a result of this bill? So let's go over some of the main features of the bill. Now, there's lots. You know, it's thousands of pages long. I'm not going to cover them all, obviously, because you'd be bored to death. I'm going to cover the most relevant parts of the bill, the part that will screw with the economy the most. One of the big points of the bill, and one that people think is so great about it, is that now people will not be able to be denied health insurance. Health insurance companies will no longer be able to deny people due to pre-existing conditions. Now, a lot of people may say that's a good thing. You know, a lot of people out there cannot get coverage because their coverage would cost insurance companies way too much. So you'd be tempted to think that's a great thing. The reality is it completely goes against the principles of insurance itself. I mean, think about it. What is insurance? Insurance is something that covers what might happen. Insurance is designed to cover really expensive incidents that might happen. Insurance is not designed to cover things that already happened. And when you force insurance companies to cover things that already happened before people were insured, that completely upsets the principles of insurance. It's not insurance anymore. You know, allow me to use a car insurance analogy. So let's say you're uninsured, you don't have any car insurance, and your vehicle, you have an accident in your car. Do you think the next day you should be able to walk into Geico or Progressive's office and say, I need car insurance. Oh, by the way, can you cover that accident I just had? They look at you like you were insane. So to expect insurance companies to cover things that happened before you even had a policy with them is not insurance anymore. Call it something else, but it's not insurance. So when you force a company to do that, just as if you were to force auto insurance companies to cover previous accidents, guess what's going to happen to your premiums? Your premiums are going through the damn roof.
Oh, yeah, it's obvious, yeah.
I mean, there's no other way to look at it. When you force insurance companies to do things they're not designed to do, like cover things that already happened, premiums are going to skyrocket whether you want it to or not. It's just going to happen. There's no way you can get around it. No law can circumvent that effect.
What about the argument that you need a public option to help bring down the cost?
Well, that's completely different. Actually, I was going to cover that later, but
Okay.
well, the main reason I'm not going to cover the public option right now is because it's not part of the bill.
Yeah.
You know, that part did not become part of the health care bill. So, and I'll bring it up later on in the presentation, but it's not that big a deal yet, although I suspect it will come back or be offered later again, maybe in the coming years. But another thing that is in the bill, you know, we just covered you can't be denied due to pre-existing condition. You are also not allowed to discriminate based on risk factors. So if somebody's really unhealthy, let's say they're obese, they're a smoker, a health insurance company is not allowed to charge them more money to cover that higher risk factor. In other words, everyone's supposed to, you know, insurance premium is supposed to cost pretty much the same. Now, when you do that, you're forcing insurance companies to take a loss. If they can't compensate for all that extra risk by charging more, guess where they're going to get that money from? They're going to get that money, they're going to make up for that loss by charging their other customers higher premiums.
Yeah.
So if you're an unhealthy person, if you're obese, if you're a smoker, yeah, your premiums may be lower. But as a consequence, everybody else's premiums are going to rise to make up for that. This is basic economics. You cannot get around it. This will happen. So that's two reasons right there.
Basically, what you're saying, just like everything else, the government gets involved in it, and their interference causes problems.
Right, and it sounds really good on paper, but when you think about the actual consequences of the bill, it's absolutely horrendous. It doesn't make any sense. I mean, if you think about this even more than one step ahead in the game, it's completely ludicrous. Another point they're going to do, they're going to require insurers to cover regular visits to the doctor. Now, again, people would think, oh, what's wrong with that? Well, once again, insurance is supposed to cover things that might happen, not things that will happen. And regular checkups to the doctor are things that are going to happen. So if you force insurance companies to cover these regular checkups, once again, all you're doing is prepaying for the service. Again, the premiums are going to go up. So I've already given 3 reasons why your premiums will go up. And all of that is based on the fact that the healthcare bill is violating the basic principles of insurance. In fact, it's not insurance anymore. It's now prepayment, which means your premiums will go up no matter what. Once again, let me use a car analogy. What if the government required that your auto insurance covered all of your regular oil changes, or covered all your regular tire rotations, or a brake resurfacing? Well, if the law required them to cover that, your premiums will go up. The insurance companies will make up for that loss by simply charging you higher premiums. Let's see what else. Oh, part of the bill is taxes on pharmaceutical companies. That's part of the way they say they're going to pay for the increased costs is to tax pharmaceutical companies.
And they'll just raise their rate.
Anyone who's got a lick of sense knows that when a company gets taxed, all they do is pass that cost on to their customers.
Yeah.
That's it. So, what was it, like the 4th way that your premiums are going to rise for really stupid reasons no one's thought of? Another thing, if you want to be able to claim health insurance on your taxes, claim these expenses on your taxes, if your health expenses are less than 10% of your total income, you will not be able to claim them. In other words, you've got to keep your health expenses 10% or more of your total income, or else you can't claim them on taxes. Now imagine what kind of perverse incentives that generates. Think about it. People will not want to get pay raises, because if you get certain pay raises, if you get a certain level, you can no longer claim those expenses on your taxes. So that's another bad thing.